This is Case of the Week 15. My name's Dr. Johnson and I'm a gynaecologist from Southampton. The patient was 45 years old and complained of severe pelvic pain for a few days per month. She'd had an endometrial ablation 5 years ago and had not had any period since then. This is a transvaginal ultrasound of the pelvis taken at that time, a longitudinal view of the uterus and a transverse view of the uterus. This is a view of one of her ovaries, seen in the transverse plane, the longitudinal plane, and with colour Doppler. What's the diagnosis? Is it endometrial cancer, a fibroid, adenomyosis, myometrial adhesions with intracavitary fluid collection, or an endometrial polyp? This is a longitudinal view of the uterus. There is the probe. This is the anterior fornix. Anterior wall of cervix, anterior wall uterus, fundus, posterior wall of the uterus, posterior cervix. You can't quite see all of the cervix there. This is the cervical canal, and this is where the endometrial cavity would be. And here you can see a fluid collection, and it's in the endometrial cavity. If you look at that in the transverse plane, you can see there is the pocket of fluid, and here, where the endometrial cavity should be, there are myometrial adhesions. In this view, you can see the ovary with a corpus luteum. This is the corpus luteum with a ring of far vascularity peripherally, which shows it to be evidence of ovulation. This was myometrial adhesions with intracavitary fluid collection due to her ablation. The history is very important. The patient was premenopausal, she'd had an endometrial ablation and had cyclical pain. Myometrial adhesions are common after all methods of endometrial ablation. This is referred to as a therapeutic Asherman syndrome. There's often some regeneration of the endometrium, often many years later and usually at the fundus. Restarting menstruation from this endometrium with the outflow obstruction due to the myometrial adhesions results in a small fluid collection in the endometrial cavity, and the patient may have some light or no PV loss, but it's extremely painful. You should always look for an endometrial fluid collection in patients post-ablation. Look for the corpus luteum to show they're ovulating. Such patients often require a hysterectomy. Thank you.